Hi, everybody. I would like to welcome you to our Palm Health seminar on the medical weight loss program, and it will be led by our wonderful Dr. Karrie Hohn. And so thanks for being here. And at the end, we'll have a Q&A if you have questions. And Karrie, I'm going to turn it over to you.
All right. Thanks, Kim. Thank you so much. I'm going to go ahead and share the screen and we'll start our presentation. Okay. So hopefully everybody can see what I am seeing. I'm here to talk today about our medical weight loss program at Palm that we've had going almost a year now. Really excited about it. Emphasis on medical. There's lots of weight loss programs out there, but we are truly medical, always wanting to help everyone reach their well-being. So first of all, Palm has been here for the past 7 years, helping people transform their health and feel their best in mind and body. We have primary care concierge physicians and mid-level nurse practitioners and physician assistants who have functional medicine training and certification. As a part of that, we also have our medical wellness services. We want to help all of our patients with all of that become more resilient, increase their vitality, and be the best version of themselves. And we're well seated to do that, bringing together medicine traditionally and functional medicine and all the wellness services here at Palm Health. As part of our medical wellness team, we have Dr. Sita Kadia. She is our Chief Medical Officer, myself, our physician assistant, Katie Chambers, and our dietitian, Kristine Townsend. So you've probably heard about peptide medications. They're all over the news. Probably lots of your friends are talking about it. These medicines, you'll commonly hear them referred to as Ozempic or Mounjaro, or Zepbound is now the new one that's come out. They suppress our appetite. They help decrease the amount of food that we want to intake, and they increase our body's metabolism and actually improve our body's response to insulin. So they can be really amazing in how they help our body and our metabolism work. But the weight loss medication is really one part of a puzzle. The puzzle has to do, not just with a medication and how that medication can affect our body, but how can we use that medication in combination with healthy lifestyle practice, monitored by a medical team to help our patients become more healthy. I can tell you that I see a lot of patients who come to me that have already tried the peptide medications, and they go to see their provider once a week. They get a shot from the nurse, they weigh them, and out the door they go. There's been no thought put to what are they eating, how are they exercising, are they maintaining their muscle mass as they lose weight? I used to congratulate patients when I would see them and they would have lost weight. And now I think, oh my gosh, what did they lose? When you lose weight, did you lose muscle? Did you lose fat? Where did you lose that fat from your body? Those are all things that we take into consideration at Palm when we help someone with weight loss. So we do have a complete team so that all of our patients are fully supported. It's more than just a weekly shot and a weekly weight check. It is a full examination to start out from our physician assistant to help her understand where you're coming from, what lifestyle changes or what changes to your routine do we want to help you make so that you can have your best outcome. So that when you come off of medications, that you're set up for success, that your body is healthier. It is as healthy as it is when you start, or healthier when you end the program, so that you can taper off the medications and keep the weight off long term. We want you to have the best success, both in your weight loss and your health. And we make that's different. I haven't heard, I listen to the radio, I hear of other patients and friends who have used weight loss programs, and I have not heard of as comprehensive as an approach as we have here at Palm. Let's see. Alrighty. So we combine medication, we have accountability and support from our dietitian, from myself, from our physician assistant, and we help you focus on diet and lifestyle changes and detoxification, all to give you an effective weight loss. So we have you first visit with Katie, our physician assistant. She will provide a complete health history. So she'll sit down with you for about an hour and go over all of the things you've tried. She'll look at all of your current medical conditions, any medications that you're taking. She'll take an inventory of your exercise patterns, your diet patterns, and then she'll help formulate a plan, an initial plan for you so that from that very first meeting, you have some action items. Part of those action items is that she'll give you a lab sheet so that we can do some labs, unless you've already had done labs recently with your primary care doctor, but we will, either import those labs or we will order new labs to make sure that your body is healthy, and to see which medications might work best for you, and looking at your biochemistry, looking at your history to see and to kind of make sure that we've individualized this for each of our patients. Also, with our Katie being so closely related to all of our patients, so involved, she's able to see possible side effects and to help you avoid pitfalls and to help you navigate your way through any difficult times. Lifestyle things that come up. How can you best address those? How can you either maintain your weight or continue to lose weight when you're going through some lifestyle issue? Alrighty. So when people use their medication just by themselves, I have had a lot of people who come into me and say, well, I took that, I lost the weight. As soon as I stopped, I gained it all back. We know that that's true. We know that it is not a permanent solution in and of itself. And medication from a functional medicine provider or a good medical provider, medication is never always, the only answer, right? Sometimes medication is necessary, but all of our medications, whether it be a diabetic medication or a blood pressure medication or a weight loss medication, we're always bringing in lifestyle factors like nutrition, exercise, stress management, detoxification, because we want to get these things set. We want all of our patients to kind of know what the current recommendations are, know how those recommendations apply to each individual person, so that you kind of come away with knowing that, and you may not do it 100% of the time, but you know what would be a healthy way to eat or to exercise, or how to manage detoxification, how we can help you do that ongoing so that when you're off of medication, you can continue to maintain your weight loss. So we help you do these lifestyle changes and maintain them with regular check-ins with the dietitian. She's going to help you figure out your nutrition, how to troubleshoot when you're going out to dinner, when you're going on vacation, how do you stay on track, and how do you maintain the healthy weight. We'll help you optimize your fitness. It will help you with stress management. And then other services here at Palm for detoxification, like our infrared sauna, our lymphatic massage, biomat, and many more services that we can bring in to really help boost your success rate. So I think most importantly is support and accountability. A lot of patients will we'll see them every 6 weeks or every 3 months, and in between time things fall off. We talk about something at an appointment and they come back 3 months later and things may or may not have gotten followed. Some people are excellent. They really are stick to it kind of people, and we talk about it and they figure out what they want to do, they do it and have great success. Sometimes that's not the case. Sometimes we just need a little bit more accountability and support, and that's where this program comes in. So we're, constantly tracking progress. So we've got weekly weigh-ins. So that you're going to, at the end of that week, have to show up and, either virtually weigh in or weigh in person, so that you can see if you've achieved your goal, and we can help make sure that you're staying on track. We want to make sure that you're not losing weight too quickly. So we like to see you as often as possible, or have the virtual check-in as often as possible, at least on that weekly, every other week basis, to make sure that we're on a good trajectory. We're not losing weight too quickly, or that you've not stalled out. And then, of course, as we're having those meetings, we want to work with you to address any challenges that come your way. And we all know that you might set out for a weight loss program, and then, something happens with your dog or your parent or a child that throws you off course and makes it a little bit trickier, one more ball to juggle while you're trying to maintain a healthy weight. So we're there to help you manage those things. So how does it actually work? At that initial appointment, you'll meet with Katie Chambers. And I will say, even before that first meeting, we're assessing all of our patients to see if they're the right fit. So if you're someone who's thinking that they just want to lose 10 pounds, this probably is not the program for you. This is a program that we're following the guidelines for these medications. So the FDA has approved tirzepatide, and they've approved semaglutide, which are the two meds that we're using. They've approved those under certain guidelines. And those guidelines are that you have a body mass index that is greater than 30, and we can treat you, or that you have a body mass index of greater than 25, and you have other comorbid medical conditions like high blood pressure, high cholesterol, diabetes, etc. So we want to make sure that you meet criteria. We never want to start a medication for someone who doesn't need it, right? So if you meet that criteria, if your weight is, if we're looking at losing 20 or 30 pounds or more, and if you have other conditions, that makes sense. It's, in terms of a risk benefit ratio, we're trying to be safe, right? We're trying to do no harm. And so we only want to offer medical treatment to patients who really require it. So we do kind of an assessment with our, Katie will meet and greet with our patients, or our navigators will meet and talk with you to make sure that you kind of qualify and you fit the program. Once you've cleared that and you're into the program, then you have your first meeting with Katie. And she will give you a very detailed overview of the program. She will make sure you've either done the labs or that you've got the labs ordered. And then she'll give you those preliminary recommendations about what you can do in terms of changing your diet or optimizing your diet, and what can you do for wellness services, such as the cryo machine or the infrared sauna, or what can you do in terms of exercise, any recommendations that she can give you. One of my favorite recommendations, that there's data out just this year about how many steps we get in a day. And there was a study done on Alzheimer's prevention, and they found that if you got at least 5,000 steps a day, there was less chance of Alzheimer's. If you got 10,000 steps a day, there was much less risk of Alzheimer's. So some of those very simple things, kind of putting it into our radar. Yeah, I want to try to get between 5,000 and 10,000 or more steps per day. Just some very basic things, getting those started if you haven't already begun to do those. The other thing she'll do, Katie, at that initial visit, will give you an order for a continuous glucose monitor, which it's really, really interesting. We send that prescription to your pharmacy. You purchase that, you bring it back, and you can either put it on yourself or we'll put it on for you. But that will monitor your blood sugar for an entire 2 weeks. So you can see what food does to your body. If you eat something, and you have exercise afterward, what happens? If you have, a dessert after you've eaten the same meal, what happens? What happens if you have alcohol? What happens if you don't get enough sleep? All of these parameters, how do they affect your blood sugar? What foods give you a more stable, even blood sugar? Which foods tend to spike you? What does stress do to your blood sugar? All kinds of things. So it's really interesting for our patients. Having an even keel blood sugar is really good for us. It decreases our inflammation, it decreases our aging, and it decreases our insulin, and insulin causes us to store fat. So if we can help you keep a stable blood sugar, that is a great tool. So So that's one thing that we will order on that very first visit, and you'll be able to start that within your first week in the program. In that second week, you will either have done your labs, or we will be getting those labs back and reviewing them. You'll meet with Kristany Townsend, our dietitian, and she will do a functional nutrition assessment, kind of looking at what are you currently doing, and how can that be impacting your health. She will look at that glucose monitor with you to see, you know, when did you have peaks and spikes, and what could it be related to, and how can we even those out a little bit. She'll also do a body composition, which I think is the most important, one of the most important tools that we have here at Palm. So it is a machine that you stand on, you hold the metal railings with your hands, and you step on the metal pads with your feet. And there's a current that flows through you, which you don't feel at all, but it flows differently through fat, muscle, and water. And it can give us an assessment of how much body fat you have, where it is, and how much muscle mass you have. And we will be monitoring this throughout the entirety of the program every 3 months, because we want to make sure that as someone loses those pounds, that those pounds lost, and we can actually see how many muscle pounds you have and how many fat pounds you have, and how much of that is deep in our belly, right? And so we want to monitor and see how much muscle mass have we maintained, or have we gained? How much fat mass have we lost? Have we lost it from the abdominal cavity or not? So we're going to be carefully keeping an eye on that. I will meet with patients. Typically, it's a 60-minute visit where we review, usually third or fourth week of the program, we review everything you've done thus far. So I will look at Katie's initial intake. I'll fill in the blanks if I have questions. I might fine tune your diet based on your lab results, or based on your continuous glucose monitor results. And in general, kind of make sure that we're headed in the right direction. And I will say the team does a great job. Sometimes there are things that I find just because I've been doing this for years, but many times you're right on track. And you may have evolved at that point through the program, that you may have more questions, right? So it's good to have just another set of eyes coming in to look and help you kind of troubleshoot and navigate as you go through on how to optimize your program. Let's see. Week 4, you're going to have a program visit. You're going to meet with Katie. She's going to, again, continue to review and go over your plan, make sure that you're getting all of your questions answered, and hopefully helping you to make progress. If you have any medication questions, diet questions, exercise questions, glucose monitor, etc. And she's going to be there for encouragement, because I think it's difficult as you get started. We start these medicines at low doses because there can be side effects, and we increase them very slowly to limit those side effects. And I will say, before I skip forward to the next slide, that medications, any medication you take, can have side effects. There are common side effects that we see with these medications. They are typically constipation, sometimes a little bit of, looser stools. We can see a little bit of nausea, sometimes a little bit of heartburn. Those are the common things that we see. And we troubleshoot those usually with supplementation. Like if your bowels are moving slowly, we can use some magnesium or vitamin C. If you're having a little bit of heartburn, we can use some diglycerized licorice. There's some things that we can do to help. Also tweaking the diet can help. So those are some of the common side effects. There are rare side effects that are not common, of, gallstones and pancreatitis, inflammation of the pancreas. Those are really rare. We're always on the lookout for those. We're checking your labs initially and then every 3 months to make sure you're not having issues, and we're monitoring your symptoms closely. And we're encouraging all of our patients, when they are taking medications in general, as a matter of fact, try to limit fats in your diet. So it doesn't mean you can't have fats, and we want you to eat healthy fats, but we want you to limit the donuts and ice cream, right? So if you decide to go on a binge of donuts and ice cream, you're challenging your pancreas when you do that. And so we want to encourage all of our patients to do that, but especially when you're taking medications like this, that can provoke your pancreas, and there is a minimal risk of increased irritation of the pancreas on these meds. So careful diet can be super helpful. And of course, monitoring is really helpful. Alrighty, month 2, you're meeting with Kristiny, the dietitian. She's going to continue helping you watch your weight, making sure the range looks good. And Kristiny and I meet on a weekly basis if she has any questions about our patients. Katie is constantly meeting with patients on a regular basis, doing check-ins, monitoring weight, answering questions. So, the program goes on and on. For the first 2 months, it's a lot of medication tweaking, dose increasing, diet modifying, side effect mitigating. Those are the things that they tend to do. And we stay in really close contact. We move on to our 3rd month where you have your weekly weigh-in. Every 2 weeks, you're going to check in with Katie. Every month, you're going to meet with Kristiny. And then, like I said earlier, every 12 weeks, we will repeat our labs and we will repeat the body composition analysis to make sure that the fat's coming off and the muscle's in good shape. And one more thing I'll say about muscle, when you're taking these medications, it's always important to exercise no matter what. When you're trying to lose weight, when you're trying to be a healthy human being, getting 150 minutes or 5 30-minute sessions of cardiac activity is really important. So that if somebody picked up your phone, somebody called, they would know that you were working out, so that you're walking fast enough that your heart rate is up and they can tell. So we want 150 minutes a week of that kind of activity. And we want whole body strength training every week. So you're getting your arms, your legs, your abs, your legs, right? That's a healthy lifestyle in general. It's really important when you're taking any medications for weight loss or you're trying to achieve weight loss. We want you to keep that muscle. We want you to build it. The other way to build muscle is to really pay attention. Am I getting 30 grams of protein per meal? So at my breakfast, at my lunch, at my dinner, am I really hitting that? How do you hit that at breakfast? I hit it with a smoothie. I have 30 grams of complete protein powder in my smoothie, which I get at Palm. The other is, my lunch, I do a leftover. My dinner, I'm typically having a half a plate of veggies. I'm having some type of lean, clean protein of 30 grams, like meat, fish, or chicken, so it's a little bit bigger than a deck of cards. And I'm limiting my grain servings, and I'm eating those in that order: veggies, protein, and then my little bit of fat and a little bit of grain. So those are some things that we'll kind of review with our patients and encourage, just to make sure that we're doing everything we can to have you stay healthier on the end of the program, and so that you can taper off meds over time and keep the weight off. So I think I'm super excited to tell everybody that we are now through January 31st, we have a special program where you can, if you sign up by then, you can get 2 complimentary 55-minute personal training sessions, which I think is invaluable. To have a session with someone. I've done it here at Palm, and it's just been really life-changing for me in terms of keeping up my exercise. I need to visit with them again and, do more with that aspect, but super, super important. I'm really excited to offer that to everyone because I think maintaining muscle mass is just so, so important. So that is our program in a nutshell. We do have navigators who can help you. I think Kim's going to chime back in. If you are interested in the program, we have our navigators, Kim Sella, Jessica Dykes. You can call Palm at 314-801-8898, option 0, or you can go to this membership at palmhealth.com. And if anyone has questions, you may have entered questions already. I'm going to see if I can find them. I don't see any questions. So I think we are finished with our presentation and we will sign off from here. Thanks, everybody.
Thanks for coming. Thanks, Karrie.
Bye-bye.
Bye-bye.